I presented a paper on behalf of co-authors regarding Sabatolimab, which is a new TIM-3 inhibitor, which targets TIM-3, which is expressed on leukemic cells, particularly leukemic progenitors rather than normal progenitors, and is also expressed on cells of the innate and adaptive immune systems. And so one key question was, how does this new drug called Sabatolimab works? Well, it's been proposed that TIM-3, when it is engaged by Sabatolimab, that it activates macrophages and other myeloid cells and the T and NK effector immune systems to attack the leukemic cells. With respect to the macrophages, through antibody-dependent cellular phagocytosis. So this mechanism is also enhanced by the fact that TIM-3 is particularly expressed on leukemic cells and progenitors, and that TIM-3 functions as an autocrine self-renewal loop through engagement of autocrine secreted galectin-9. And so TIM-3 antibodies, again, are thought to disrupt this pathway, reducing leukemic cell growth. So the abstract was a presentation of an ongoing phase 1b study, which combined Sabatolimab with hypomethylating agents, either decitabine or azacitidine. Sabatolimab was either given on days 8 and 22, that is twice per cycle, or once per cycle on day 8 as an infusion. In terms of the study, with respect to patients with myelodysplastic syndrome, a total of 53 patients with higher risk MDS have been studied so far, and the median age of this population was about 70 years. The majority of the patients had very high risk disease according to the revised IPSS score, with 40% of patients having very high risk and 60% of patients having high risk. Interestingly, about 23% of patients who went on to the hypomethylating agent Sabatolimab combination with high-risk MDS went on to have an allogeneic stem cell transplant, and at this stage, there's no evidence that there were unusual complications as a result of the transplant. The median time of patients being on treatment with Sabatolimab in combination with decitabine was 8 months. This was longer than patients who were on combination with azacitidine, because that arm of the trial started about 18 months after the decitabine study commenced. In terms of tolerability, Sabatolimab plus hypomethylating agents was very well tolerated, and there were no unusual adverse events in excess of what we would normally see for patients with azacitidine alone. With respect to efficacy, Sabatolimab plus hypomethylating agents in higher risk MDS demonstrated an overall response rate of 58%. This included 20% of patients who achieved a CR, 24% of patients who achieved a marrow CR, 2% who achieved a partial response, and 12% of patients with hematologic improvement. One of the most outstanding factors of the study was that these responses were durable. So the median duration of response was 16.1 months, and in patients that achieved a true CR, the duration of CR was 21.5 months. In this trial, there was also some subgroup analyses done on patients who have higher risk molecular features, including P53 mutation. And in this study, there were 14 patients treated with P53 abnormalities, and the overall response rate was 50%. This included 29% of patients that achieved a true CR, and 14% of patients a marrow CR with hematologic improvement, and another 7% of patients that achieved a partial response. Most importantly, these p53 mutant cases that had a response duration of almost 15 months. This abstract also presented some new data with respect to correlative studies of sabatolimab in combination with hypomethylating agents, and serial single-cell RNA sequencing was performed, which interestingly showed a reduction in the inflammasome marker interleukin-1b in the leukemic progenitors, but an increase in interleukin-1b in myeloid effectors, consistent with the role of macrophage activation. And so in conclusion, the studies showed that sabatolimab in combination with hypomethylating agents in high-risk MDS was well tolerated. Promising efficacy was seen, including patients with poor risk disease, and the hope is that future pivotal studies will go on to demonstrate that sabatolimab might have an important role for patients with MDS.